Thank you so much, Michael Froman, for those remarks. Your points about the need for collaboration across sectors and industries really resonates, especially during a time when systemic inequities have been laid bare during the pandemic. So hello, everyone. My name is Anita Lee. I'll be your host for today. I'm a journalist, media consultant, as well as the founder and CEO and editor-in-chief of a hyperlocal independent news outlet here in Toronto called The Green Line, which is all about investigating the way we live to help young Torontonians and other underserved communities survive and thrive in a rapidly changing city. So my mission at The Green Line really resonates with Reach's mission, which is to pursue the full achievement of the SDGs by equipping and empowering the next generation of global leaders to create knowledge and inspire action on reaching the hardest to reach. That really resonates with me, as does the theme of today's symposium, which is resilience. So to kick things off for day 2, we're excited to share the first case study video of the day with you. It looks at how a public-private partnership was used to deliver telecommunications services in Peru. So let's take a look. So that was a fascinating case study, and I hope you all took away some concrete, actionable insights. So I just want to remind everybody to please submit questions at any time throughout the conversation. I'll bring them to our guests following the discussion. So that brings us to our first roundtable discussion of the day, which will focus on mitigating global health shocks. It's my distinct pleasure to welcome the project officer of the Canadian Council for Youth Prosperity and Reach alumni, Mhlanga, who will be chairing this discussion. Mdu is joined by the Director of Policy, Infectious Diseases and Pandemic Preparedness at Global Affairs Canada, Kristen Chenier, the Group Director of Partnerships and External Affairs at Amref Health Africa, Desta Lakew, who is joining us from Nairobi today, and Senior Medical Editor at the Lancet, Jessamy Bagenal. Mdu, over to you.
Thank you so much, Anita. Such a pleasure to be speaking to such a wonderful set of really accomplished folks. Very much looking up to all of you, and definitely aspire to reach, let's say, even a quarter of your knowledge and expertise in this topic. And I'm really excited to kick off this conversation. But before diving into some questions, really, I wanted to also set the stage a little bit for our conversation, in that keeping in mind, while our topic is specifically on mitigating global health shocks, the broader reach theme for this symposium is really about resilience, as Anita was saying. And something that honestly came to mind for me when I was thinking about resilience is a bit of an exercise I like to do every once in a while. I don't recommend folks do it often because it doesn't tend to be pretty fun, but do try to take some time to think about some of the biggest shocks that have happened in your lifetime, and really try to think of just how that might have spoken to any element of resilience for you and for the global community. So speaking for myself, for example, just in my lifetime, it's 9/11, the war on terror, Ebola, COVID-19. So yeah, I've had a fun 24 years. It's been fantastic, and really, we're of course in the midst of the COVID-19 global health shock right now. And when it comes to resilience, I think the biggest thing that we can be thinking about right now is with respect to vaccinations. And with that, I'd really love to kick off this panel with a question for you, Desta. I know your organization has some experience leveraging partnerships to accelerate vaccine delivery and equity. And I'm just curious, in your role as partnerships lead, how have you used the advocacy? How have you used not only advocacy and communications, but also technical program implementation to actually make this happen?
Thank you so much, Ndu. And maybe for those of you who might be on this call or listening in that don't know who Amref is, let me just give you a brief background. So Amref is the leading health development NGO that's headquartered in Africa since 1957. So for over 6 decades, we've been on the continent. And our focus has really been to ensure access to health to the most vulnerable in Africa. And as an organization, we manage over 150 projects in 35 countries, and we serve more than 12 million beneficiaries annually. So we are a large organization. We have been around on the continent for quite some time, and therefore we have a little bit of a little bit of an advantage of being an organization that has worked very, very closely with partners in the region. So we are at an advantage. We work extremely closely with national and subnational governments. In fact, most of the work that Amref does is really based on the health priorities of the ministries of health in the countries in which we work. And then, of course, we work with regional bodies, more recently, Africa CDC, the Ramaphosa Commission on COVID, WHO, AU, and then other development partners, private sector partners, and civil society organizations. So we are in a position where we are already sort of structured and have been operating with partners at the heart of the work that we do. And of course, because we are based in the communities in which we work, our partners actually are able to come to us and work with us to deliver direct service or, in fact, outreach or engagement at community levels. So we're positioned a little bit differently than many NGOs. And that means also because of the role that we play in the community, we oftentimes sit on technical committees at the national or regional level, or even subnational level. So that gives us access, that gives us also a place where we can actually see where policies are actually implemented and what happens on the ground. And we are always in a place where we've been advocating for community. So heart of everything is community is first. Our advocacy is focused on community. Even before the pandemic, we've really looked at gender issues, youth issues, all of these type of issues that we advocate around, empowering youth, empowering women, all these type of things. So when COVID, of course, came, it's an interesting one. We were in a space where we could actually react immediately. And the first thing that we did and how we used our partners and leveraged that type of reach for us was we actually brought on in Kenya. I mean, I think March 2019 is when we had the first case of COVID. And within the month, we actually had a coalition of partners and we formed a National Business Compact on COVID. And that meant bringing together our UN family, our government partners, our private sector partners to say, what is the first thing that we need to do around this pandemic to ensure that people are safe? We weren't even speaking about vaccines at that time. We were just talking about risk communication, prevention, because frankly, our health systems were fragile already, and the pandemic now has exacerbated that. So the first focus for us is really to organize partners around prevention. And that was a big message and push that we did with our partners was really pushing that out. So now we look back, going into the third year, and what are we seeing? Today, less than 15% of the 1+ billion Africans have been vaccinated. So even as Gavi seeks to support vaccine delivery, we see so many local obstacles for getting vaccines into arms. So we have done quite a bit of advocacy and communication around this issue. And of course, we can't do it alone. So while internally we align our advocacy efforts and we've created a platform to share things as a global organization, which is what we are, at the community level, we've had to really leverage, number one, existing advocacy platforms like, we have a Youth in Action platform, which includes like 61 youth-led organizations across 21 countries. So we began to say, how do we leverage the connections, the commitments, the partnerships we already have? So using this Youth in Action platform was really critical. And it was very broad-based. So that was one way which we reached sort of youth with information about COVID, and now more recently in the last year or so around vaccine delivery and access to vaccines, and really trying to get young people to think about how do we access vaccines. So I think for us really, our partnerships are really critical, but we also said, how do we engage our partners in really important things like advocating for campaign equity? So we actually launched a global vaccine injustice campaign. We invited many of our partners to join us, and in fact, all of our partners to join us. And the campaign was launched about, I would say, 5-6 months ago, and we already have over 200,000 signatures on the campaign. And at that time, we had, and still now, we are actually calling for things like, ending stockpile vaccines in rich countries, limiting large-scale booster rollouts, when Africa is, less than 15%, sharing more vaccines and sharing faster, and then also looking at licenses, technology, IP waivers, etc., for COVID vaccine manufacturing, and then looking at how do we advocate now for self-reliance? How does Africa never again find itself in this position? So what we've done is we've taken all of our partnerships, the strengths of our partnerships, we've engaged them in an advocacy effort. We actually have now taken this vaccine injustice campaign because we realize, that's not just enough, but we've been engaging partners like the T7, and we've just now recently supported also development of policy on vaccine equity, which we co-authored with other members in LMIC in India and Costa Rica. And we've been working really with the T7 to support the development of a policy issues paper that'll be submitted to G20. So that's sort of an example of how we've taken advocacy, engaged our partners, and then use that advocacy to really drive policy development that we will now present at G20. Separately, though, we also have platforms. We have our own platforms, advocacy and information platforms. We launched an Africa dialogue on COVID. And we did this because there was really no information out there. There's no information that was clear, that was reliable. We had experts and partners come on. So in our view, this Africa dialogue was extremely successful. At any given time, you would have between 300 and 800 people really signing on to listen to the dialogue discussions, and they were bi-weekly. So what we did is we used our partnerships to really leverage communication around the issue of vaccines and vaccine equity, and certainly vaccine delivery. And then we also have a biannual event that we do called AHEC 2021. It's a platform that we own, but it's really led by our partners. So in 2021, we actually had our biannual convening virtually, and then we invite our partners to really help us to build the agenda. So our view is the more information, the more partners are engaged and support shaping agendas, we can get information about vaccine injustice or lack of equity on vaccine delivery for Africa. So, excuse me. So that's what we've been working on, and really leveraging those platforms, our comms platforms, our advocacy initiatives to push out information about vaccine injustice availability. When you look at vaccine delivery right now, In the urban settings, there's more vaccine in arms than there are in the rural or hard to reach communities. So we're looking at, the need for data to understand and really drive vaccine delivery, those type of things as well on a programmatic level. And of course, training of community health workers so that they understand how important vaccines are, push out that information at the community level and really generate or drive demand for vaccines. So that's what we're doing on the work side, on the programmatic side. But certainly, I think for us, advocacy and communication has been critical to really even informing the African public about what's happening.
Right. And honestly, it sounds like that element of being really close to the community is a key part of it, of really understanding local needs and making that effort to make sure that you're not just kind of just some third-party observer somewhere in the ether, but you're really involved and you're able to get that kind of frontline knowledge that's really, really critical. And that's something that's come up a lot in a lot of some of the REACH case studies that we've done over the past few years. So I'm really glad to hear that. I'd love to shift over to Jessamy now. So I'm going to put you in the hot seat for a minute. We're really just curious here that, so I'm certain you would agree that there have been some really bold proclamations in mobilizing health for all when it comes to the SDG agenda. But kind of despite these proclamations, it seems like the global community has unfortunately continued to fall short of achieving universal health coverage and really reaching the hardest to reach folks at the margins, right? And so my question to you very simply is, what do you think needs to be done differently in order to actually catalyze change?
Thanks so much. It's lovely to be here. It's a huge question. I'm probably not going to be able to answer all of it, but I do think that I'd like to focus on two aspects. And one of them is about the political economy around universal health coverage. And I think that it's still very much seen as aligned with certain political ideologies because of the amount of money that's involved, but because of the sort of involvement of the state. Universal health coverage, health for all, it's about rights and it's about equity. But in preparation for this conversation, I look back at, a lot of the things that we've published over the last 10 years. And when we published a commission in 2013 for investing for health, and some of the responses that came back to that, the words that are being used around universal health coverage at that time, and something that I think still, continues, is that, it's about the healthy and the wealthy subsidizing the poor and the sick. And that type of framing, that type of narrative, for me, is incorrect, but also is a turnoff to a huge number of people around the world who have different political persuasions and who don't necessarily feel that that sort of altruistic program is something that they would want to buy into. So I still think that there's a lot of work to do around understanding the very different paths to universal health coverage that don't all have to be the same. They don't have to be aligned to a political ideology, and to reframe the discussion as we are here to one that is about resilience and anti-fragility. Because for me, universal health coverage is about making a population as healthy and as resilient as possible. It's not about the healthy and the wealthy looking after the sick and the poor. It's about making your population healthy so that you can combat the crises which are on the horizon for all of us, increasing pandemics, climate change, non-communicable diseases. And I think that there's a lot of work to do in changing that narrative and changing that framing to bring people on board who may have just sort of inherent problems with the concept of health for all or universal health coverage. It's easy for us to talk to each other where we all think, obviously health for all, universal health coverage is a great thing. But we often forget that it's not assumed that this should be the way forward. And I think there's lots of work to do around there, and there's good examples as well. I mean, I think when you look at Turkey's journey towards universal health coverage, there was some very strategic management of political trade-offs there to try and combat, certain groups that may have differences of sort of opinion about universal health coverage. So I think there's a lot to do there. And the second thing is within countries, universal health coverage is not always universal. And, as the sort of the REACH name goes, to reach those that are at the margins and that are hardest to reach, those inequalities that exist within societies, I think they translate into problems of access, and that reduces trust in the concept of health for all. It reduces trust in the concept of universal health coverage, and it diminishes demand for it. And it, poor quality services, quality is another issue that we don't focus on enough. I think we've seen through the pandemic, many feel that the way that we're organising our societies isn't working. And I hope that the window of opportunity to push this agenda about resilience and anti-fragility is still open, because health will definitely be the defining feature of the 21st century. It will be involved in every single aspect of our life. And so I think that the health and science community need to advocate for health to be at the centre of all policies. It's easy for us to feel that because there's been a shock, that somehow there will be a sort of inevitable arc of history towards progress that will be potentially liberal, that will be equity-based. But that isn't true. We've seen that historically time and again. Shocks, crises have not always led to more progressive policies. When you look you look at sort of after World War I, and some of the sort of toxic policies there that actually increased inequality, they increased poverty, they led to a sort of spiral of problems. And so we're in this point now where it's easy to feel that a shock should lead us to somewhere towards resilience and anti-fragility, but that's not necessarily the case. And I think that we as the health and science community, we have an awful lot of work to do in that pushing agenda for health to be at the very centre of all policies in government. And that involves moving away from metrics like GDP, moving away from measures of success, so that we're thinking more about well-being societies, things that are being tried in, New Zealand and elsewhere. So I think, in answer in summary to your question about how we can catalyse change, we are at a moment now. It's not necessarily going to lead to resilience. It could very well lead in a different direction. And it's our responsibility to push that agenda, to push that change, and to make real gains in health for all and universal health coverage. I think we need to see real changes at a societal and global level about how we organise our things, what our values are, and how we measure success. So that's me.
Very well said, Jessamy. And something that really stuck with me from your comment there was, I think you said something about like having a specific window of opportunity, and that's very unfortunately the reality of how a lot of things work when we're in crises or when we're experiencing shocks. It's really about that window of opportunity, because that's the time when you're going to be hopefully able to gather the political kind of muscle that you need to make things happen. You're able to get the money. You're mentioning the importance of the political economy aspect of things. That's really when you really need to get your stuff together and get things done very quickly. But once that window of opportunity closes, of course, then things start to dry up, right? And that's an unfortunate reality of how I think there tends to be a reaction when it comes to global shocks and global crises. But with that, I'd love to transition a bit to you, Kristen, to identify, speaking more specifically to Canada and what our role can be in these kinds of circumstances. I know, Kristen, you've represented Canada in various roles around the world, and you've really led Global Affairs Canada's policy engagement when it comes to the global health space, including at the WHO, the G20, and the G7. And so given your international experience, I'm curious, what does the global community need to do better in order to support health system resilience? And specifically, what role do you see for Canada in this effort?
Good morning, everyone, and thanks very much. And it's really a pleasure to be with you today. So the answer to that question is a really live discussion that's taking place right now. And I think from our perspective, what needs to be top of mind is not only ending this pandemic for everyone, but using the heightened awareness about global health security and health equity to really take concrete action on the lessons learned from COVID. And as you say, is really seizing this window, to try to make lasting change while we have the political attention. And this is not only about strengthening our collective ability to detect and contain outbreaks, but also about strengthening health systems more broadly so that we can make progress on SDG 3. And it's clear these issues are inextricably linked and mutually reinforcing. So there have been a couple of key COVID review bodies that have made recommendations to strengthen the global response to pandemics. And these include the Independent Panel for Pandemic Preparedness and Response and the G20 High-Level Independent Panel. A lot of their recommendations focus on governance and financing issues, and I'll just give you a couple. So increasing investments in core pandemic preparedness capacities like surveillance, diagnostic capacity, the frontline health workers, and particularly in low and middle income countries. Ensuring equitable access to vaccines, tests, and treatments going forward, having a sustainable solution for that. Establishing new financing facilities for pandemic prevention and preparedness at the World Bank, and strengthening the authority and financing of the World Health Organization. So on Canada's role, Canada really is a significant player in global health. About 20% of our overseas development assistance goes to the health sector. We're among the top donors and represented in the governing bodies of all of the key global health institutions. For the COVID response, we're talking about vaccine equity. We are the 4th largest donor to the ACT Accelerator, the global partnership focused on equitable access to COVID-19 tests, treatments, and vaccines. And we're shaping global policy agendas at the WHO, at the UN in New York, and in the G7 and G20. And when we do that, my team is focused on making sure that Canadian positions are really informed by evidence, by those recommendations that have come out of the pandemic, and bringing our feminist international assistance policy lens to those discussions. And this means when we're talking about global health security, we bring a strong focus on equity in reaching those furthest behind that we've all talked about, listening to the perspectives of low and middle income countries and their communities, and along with civil society actors. And it also means not losing sight of the need to make progress on SDG 3 overall. And that means including to continue to invest in the fight against other infectious diseases that don't pose as much of a threat to us domestically, like TB, AIDS, malaria, and polio, and also maintain a focus on the sexual reproductive health and rights of women and girls, and like everyone is saying, working towards universal health coverage. I would just say finally, from our perspective, there are already significant resources that are invested in strengthening health systems, but they tend to be fragmented and not have health system resilience as their primary raison d'etre. So there's a lot that we can do to ensure greater collaboration and coherence around global health efforts to support countries and communities on this issue as well. Thanks.
Thank you so much, Kristen. Honestly, as a Canadian, it's always amazing to hear that we have some special role to play. I think there tends to be not usually enough space for Canada when we're thinking about the global stage, especially in these kinds of crises. But I'm really glad that we have some opportunity to really lean on folks such as yourselves and at Global Affairs Canada, but also the rest of the Canadian community in order to try to make a difference in navigating these kind of difficult circumstances. So I want to shake things up a bit here. So we were given some interesting audience questions. So I want to make sure we make some time for their discussion. And really the first question came up, I think, when Desta was speaking, but I think I'll leave this open to anyone who might want to answer. And I'll start with saying, I'm just going to read it out loud for everybody. In a continent with poor vaccination rates, Rwanda stands out with over 60% of the population being vaccinated. Rwanda also stands out for strong government leadership regarding the health mandate. Mitigating shocks requires strong country health systems driven by country leadership. How can external partners support country governments to take similar ownership towards health preparedness prior to the health disaster occurring? So this is a question from one of our REACH researchers, open for anybody.
Let me just take a stab at it, and then I'll let my colleagues do that. Absolutely, 100%. I mean, Rwanda's health system has political support. You know, there is Rwanda has a government and Kagame behind what he's doing, so a lot of political will there, and surely we're going to see that playing out also in terms of the vaccination rates and in terms of also the work that Rwanda has done in strengthening their health system. Absolutely, we need to have stronger governments, supported governments, and we try to do that. And I think for African countries and what this pandemic has shown us is that we have a very fragile health systems across the continent. In some cases, of course, Rwanda is an exception, maybe South Africa. There are some countries that are exceptions, but by and large, one of the big challenges that we saw in terms of the fragility of our health system is the health workforce needs to be ramped up. So how do you create a strong health system? You need to have a fit-for-purpose health workforce, which is something that many African countries are now coalescing around, is even harmonizing their curriculum, making sure that we have the people that we need to lead the future, making sure that governments are making the appropriate investments in the health system, and making sure also that governments have strong political will that supports the development and of whether it's infrastructure or training of health workers or even delivery of care. There are so many aspects to healthcare delivery, from outreach, from facilities, from supply chain, and you need not just political will, but you need also dedicated investment. And I think that's something that we're seeing is a challenge for many countries.
Thank you, Desta. I'll open the floor to Kristen. Jessamy, any immediate reactions?
I can maybe jump in and just agree very much that Rwanda has really been excellent and really a role model in Africa in terms of universal health coverage and their health policies, and playing an important political and advocacy role at the AU as well on that. Certainly, if we're going to reach SDG 3, if you're going to make progress towards universal health coverage, it will always primarily be domestic investments and countries' responsibilities and country ownership and country plans that lead the way, and the global support will always be secondary. So it will be important, but secondary, and it's really making sure how we can best be supportive, and making sure that the support that we give is provided in a way that's aligned with those plans and priorities, that's that's not fragmented, that's really based on aid effectiveness principles. So thanks.
But I think it's important to note that partners are really important to national governments. And partners should really work closely to understand what the health priorities of national governments are, and then align their support or their partnership around that. Oftentimes there are partners who will come in and they have an agenda already in mind. Hold that agenda for a hot minute. Go and talk to the ministries of health and really look at what the priority is for that country, and then align around some of those priorities.
And if I could jump in here with a bit of another audience question that also I think lines up really well in this topic here, which is thinking about kind of going back a bit to vaccination and developing vaccines. And I think that the point of partnerships here might be particularly relevant. So the question we had from the audience member here was, kind of thinking of preventing health shocks, wouldn't the use of the same coordination lines and tools to develop vaccines against other diseases, including existing ones like malaria, dengue, etc., wouldn't those be an option organizations should really advocate for? And what's your immediate response to this? Again, floor is open for anybody to jump in.
Maybe I can oh, there's a bit of an echo, and just say, yeah, it's a really great question. We've seen, how quickly the world, the private sector, the public sector came together, and scientists globally to develop vaccines in record time. And there are similar collaborative efforts around other diseases as well. In health, there's all this suite of product development partnerships that bring the public sector and the private sector together to incentivize research on diagnostics and treatments and therapeutics, but they haven't had the engine of that we have seen COVID. They haven't had the traction that we've seen at COVID. So definitely that is a question to go forward. The ACT Accelerator has been this new partnership that's come together to ensure greater access equity to these countermeasures. And that's really part of the thinking right now, is how do we build on the lessons of that ACT Accelerator so that it can be useful for other diseases. It can be useful, it can be of broader purpose and have a sort of a sustained capacity going forward, for sure.
Mdu, if I can just comment on that, I'm sorry. On the area of vaccine manufacturing, I think, and in Africa, on the continent here, we have the Partnership for African Vaccine Manufacturing, and quite a bit going on around, how do we create a vaccine manufacturing hubs on the continent? The challenge really is not just on the manufacturing side. The challenge is also on the supply chain side. And I think that's a conversation that's not happening, or unless someone has asked about that. But beyond even manufacturing vaccines, if you think about Africa, Africa is Gavi's biggest customer on vaccines, pretty much. And unless regional manufacturing hubs on this continent, for example, have access to the supply chains and have access to really go through Gavi, like an organization like Gavi, then the manufacturing will not be successful because we won't have a market for it. So we need market access in addition to the ability to manufacture vaccines, right? Why would anyone, if they're getting free COVID vaccines from COVAX, go and buy vaccines that are manufactured in East Africa, West Africa, Southern Africa? So I think, when you look at the manufacturing issue, you have to also look at the market access issue simultaneously.
No, absolutely. And I think I've been really excited to hear about public-private partnerships coming up quite a bit here, because I think it seems like, at least among all of you, there's that recognition that while policy is certainly important, it's rarely ever just going to work on its own in isolation, right? And so there's a critical aspect of recognizing where you're able to leverage other knowledge and other resources, either from an external perspective or within your own country or national identity, right, in order to identify some solutions. So I've been really glad to hear that. I had another question for all the panelists today. And Jessamy, I'm going to make you answer first, just as a heads up. So most of the young leaders attending today's REACH Symposium have let's say, a thorough understanding of the UN's SDG agenda, and really they're all committed to reaching those at the heart that are hardest to reach. And we're just curious to hear from all of you, what advice would you give these emerging leaders so that they can really maximize their impact and drive change in their respective sectors?
Thanks so much. Can I just come back to a couple of the points that have been made already? Because two things. One, I'm not sure that the public-private partnerships have been so wildly successful and brilliant. And then also I wonder whether there's a missing link here, in the sense that, 2022 was undoubtedly the year of, or 2021 rather, was undoubtedly the sort of year of science, was the year of vaccines. It was great progress from a scientific point of view, but it was the political determinants of health that held up any vaccine equity. And so I think we can't miss that section out. Like, we can talk about manufacturing, we can talk about supply, we can talk about demand, but ultimately we have to talk about the political determinants of health that had led to such dire vaccine inequity. And although there's been many global mechanisms and infrastructures to try and distribute vaccines equitably, we haven't got that yet. And we need to analyse that and think about it deeply, I think. And about change and how to have the biggest impact, I think that we need to analyse change. We need to become masters of how change happens. I recently read a book by Ed Miliband, who was the Labour opposition leader during the early part of the Conservative years in the UK. And even at that incredibly senior level of politics, he recognises that he didn't understand how change happened. He didn't really understand what had to happen for, say, gay marriage to become legal in the UK under a Conservative government. And I think that we need to take a scalpel to change and understand how it works. And you can do that in two ways. Ed Miliband talks about these sort of 3 different levels. So on your first level, you can change an individual law or policy, say for a minimum wage. And then on the second level, you could try to change where the power lies. So this might involve, campaigning for a change in the law. For example, to make it easier for trade unions to organise, or harder for wealthy individuals to fund political campaigns. But by shifting the structure of power, you've made changes down the line easier to make. And then the third sort of highest level of change that you can have is sort of to change the national conversation. So in other words, to change Overton's window, this window of opportunity that we so often have. So I think, there are those ways, but then there are also some more scientific ways, to think about doing theory of change models or logic models, MRC guidance on sort of looking at things as very complex interventions. But to have impact, I think we need to be real and to really analyse how change works and what makes change happen. That would be my answer.
Thank you, Jessamy. Desta, Kristen, any reactions?
Yeah, sure. Look, I am sitting today in the continent that probably has the highest percentage of youth. We have 70% of sub-Saharan is under 30. So we're dealing with a huge population. And my view is the following. Having seen how effective youth advocacy networks have been, particularly the ones that we have been engaged in with our partners at Amref, my view is that there is power in numbers. And youth, you are the numbers. Hands down, you are the numbers. And I think that many leaders also are beginning to recognize the importance of having the youth perspective reflected in decision making and also planning, because today, we are planning for young people, and that really shouldn't be the case. We should have representation, organizations and leaders across the continent and across the globe should really look to see how can we have youth representation in boards, youth representation on committees, technical and otherwise. I would say to the young people or the youth here, of which I am not one, that your voice is really powerful, and reach out to your local leaders, CEOs, directors, etc., to make sure that you're heard, and even reach out to your local parliamentarians who are at the space where policy is actually defined, and see if you can get audience with them to support adjustment of policies that are youth-centric and youth-focused. So that was what I would say.
Thank you. And Kristen, any advice for emerging leaders on maximizing impact and driving change?
Yeah, maybe just a couple of thoughts. And one thing for sure I would note is that, as individuals, as if you want to be an international development practitioner or you want to work in this field, it's really important to seek out opportunities for learning from organizations in the global south. That's really key. I'm speaking as a Canadian, as Canadians who want to work in this area, go out and listen to these organizations. And, I've been in this field a really long time. And one of my most formative experiences was working as an Aga Khan Foundation fellow in Bangladesh with the Bangladesh Rural Advancement Committee. And as a young professional, and you're as a young professional, you're there to learn, to absorb. You're not coming with any agendas, any priorities. You go and listen from some of the best, organizations in the world who know their country and what they need. So that's one thing. I would just say also, maybe tying into what Desta was saying, youth have such a powerful voice, and looking for opportunities, and you're already doing this already, I'm sure, but to raise awareness in Canada about Agenda 2030 and the importance of overseas development assistance. We know that overseas development assistance is only one small tool in a toolbox to lead to change, but it is a really important one still. And the level that Canada contributes and gives to overseas development assistance is really a function of Canadian support for and understanding of it, right? And we can't take that for granted. So, having young leaders engaged on that and is really important. Thanks.
Mdu, maybe before you wrap up, let me just give you an example, an excellent example. In 2015, when we had the AHEC, we actually had it in Kigali, and we had youth actually take a caravan, and they rode from Nairobi to Kigali through Uganda. And in Kenya, we're a devolved government. So in every county, they sought audience with the leadership in that county to talk about the importance of involving and engaging youth on UHC and planning for a delivery of achieving UHC. So maybe they didn't think about the border challenges from Kenya into Uganda, from Uganda into Kigali, but that was such a powerful movement, and it really woke people up. And so I say, not just use your voice, but act. And collective action has shown, even in different contexts, to be very effective.
Yeah, and if I could just piggyback on it, that is what sort of level 3, changing the national conversation is all about. So I think that's absolutely right.
Thank you. I know we've got about 4 minutes left, but I was very eager to squeeze in one last question from the audience. I think it's a very interesting question, and I think Desta, we'd love to get your reaction to this question. What opportunities are there to leverage non-Western epistemologies on health and wellness globally through public, private, and civil society partnerships, and how has this impacted the response to the COVID-19 pandemic? I know it's a very big question to try to answer in about 3.5 minutes, but generally, what's your take on how we can leverage non-Western knowledge on health and wellness in situations like this?
Leveraging non-Western knowledge on health and wellness. Let me tell you something very interesting. And I know Lancet is on the call, so let me just put, a lot of times we look at research validated data or information as the data to go to. But in many of our communities, especially on this content, we actually know what the solutions are. We know what the problem is. We typically know what the solution is or could be. So I think we need to look at knowledge generation, not just from formal, peer-reviewed, researched article, but there's also lived experience knowledge. So I think that we need to begin to look at what is the lived experience knowledge of communities that will allow us also to come up with solutions that will impact in a very good way and sometimes even sort out some of the challenges that we might have. And I'm not sure if I answered that question, but if it's talking about informal knowledge, informal knowledge is passed on knowledge or experiential knowledge, I would say that we need to begin to think about how we collate that and how we use that to influence our decision making also.
Absolutely. Thank you so much, Desta. And thank you, Kristen and Jessamy as well. This has been an extremely thoughtful conversation and really thought-provoking. And I think not only I'm speaking for myself, but really the Reach audience members, I think they've gotten quite a bit out of this conversation. So thank you again for your time. It's been an absolute pleasure. And now I'm really excited to share another case study example highlighting how the Healthy Pregnancy Project is improving maternal health outcomes among rural indigenous communities in Guatemala. Let's take a look.